my today's topic is to how to lose the weight through your food and nutrition, not through exercise. So exercise, it is left to you. Hi friends, I am Dr. Rakesh from Dr. Hill Pain Cure Hospital, Bangalore. Here I am going to give some very important tips for weight loss. These tips have helped me to lose my weight from 93 kg to 78 kg. I was overweight during COVID period, during the pandemic, and then I started following these tips and it helped me to lose a very significant amount of weight in a short period. Even these tips are followed by my patients also. One patient, she came for knee joint like pain, and she was 100 kg and it was overweight for even for her knee joints also and even for her body also, and she started following whatever these methods I gave to her, and she told almost in Kannada, I am putting this Kannada around a small bit of this video what she told me, and she lost around 22 kg in 3 months period, and she followed these protocols. And most of my patients usually they come for pain treatment, and they are following whatever the diet tips I am giving through these videos, and before coming to me, she had lost around 6 kg in 1 month, and also 40% of her back pain in that 1 month, and without meeting me. So these tips are helping you in such a way that where you are going to lose your significant amount of weight. There are two methods of weight loss. One is hormonal model, and another one is caloric model. Caloric model, like both the things are very beneficial, like we have to count the calories and we have to eat accordingly like that, but hormonal model will definitely help in losing the weight and also sustaining the weight, and later you can adapt come back to the caloric model as well. So I am suggesting you to go for a hormonal model because it will help you to cut down your cravings and also to cut down your weight also. So as soon as like I will start like from morning till night, whatever the things you are going to eat throughout the day, accordingly I am going to help you in understanding these things. So as soon as you wake up, as usual, you will go to pass your motion, and then you are going to brush your teeth. Then you are going to drink 1 teaspoon of 2 teaspoon of coconut oil, virgin coconut oil preferably. And why coconut oil? Because I have made one video on coconut oil also. Why coconut oil? Coconut oil will help you to lubricate your gut and to prepare the entire gut for your day. And also the coconut oil will help you in like cleaning the fatty liver, because most of the obese people are having fatty liver by default. And coconut oil has its own benefits. Basically, if the previous day like if our diet was not good, and if it is going to help us to clean the motion also. Suppose after today morning we have already motion, and after drinking the coconut oil within 1 to 2 hours it is going to help us to pass the motion once again. And after this then drink hot water. After 20 to 30 minutes of drinking coconut oil, drink hot water sip by sip, like it is like sip by sip, more than 300 to 500 ml of hot water, sip by sip. Then leave it for half an hour to 1 hour. Then in that period you may start workout, you may not be working out, you may sit. But my today's topic is to how to lose the weight through your food and nutrition, not through exercise. So exercise, it is left to you. So then you I suggest you to drink ash cut juice. Ash cut juice, like you peel off the skin and take off the seeds also, and then cut it into pieces and put some 200 to 300 ml of water and then mix it. Make it a 300 ml of fresh juice. With you can add pepper or rock salt and anything needed to if you need it for taste, and then drink it. Then followed by it, because followed by it you have to drink amla juice. How to make amla juice? Amla juice, cut 2 amlas, either like there may be like desi varieties of chote amla, or the bigger ones which are hybrid varieties. Anything is fine for the time being. Then cut it into 2 pieces, 2 to 3 pieces, and take out the seeds and grind it in the mixie by adding some 200 to 300 ml of water, and drink it. Why ash cut juice and why amla juice? Ash cut juice is going to clean your system from cells to from cells intracellular, from the at the level of mitochondria, at the level of your the nerves and blood vessels. It is going to cleanse it is like a sponge. It is going to absorb all the dirt in the body, and this amla juice is going to increase the metabolism of the body. So in that way it is going to help you in a better way. Then here I am going to tell you about intermittent fasting of 8 hour to 16 hour window, 8 hour eating window and 16 hour fasting window. And after drinking ashka juice till around 11 to 12 am, you are not, 12 like 11 to 12 pm, like afternoon 12 o'clock, you are not going to eat anything. You are going to just drink like hot water if it is needed. Then at 12 o'clock you can go for carbohydrate. Carbohydrate may be like it is like any type of rices, or even like native rices, or like or the rotis, or the ragi ball, whatever the like native food style is there. Carbohydrate basically. Here all my patients avoid this. I advise them to avoid all the like wheat, like chapati or upma, or like milk products like milk and curd. And coming to this coffee, tea and all refined sugars, all refined oils during the process of weight loss, and also in future also, and during the process of pain cure method, like during whenever they are recovering from rheumatoid arthritis or osteoarthritis or back pain or any type of pains, I advise them to avoid these things because it has own scientific explanation, which I will be explaining some other videos. So after like during lunch, before eating any carbohydrate like any ragi ball or roti or any type of rice, before that you have to eat lot of fibers. Fibers like in the form of like soup or vegetables, vegetable sabji, or raw vegetable salad. Anything you are going to eat, because the why fiber before carbohydrate, because fiber is going to become a break or kind of speed breaker in the absorption of sugars or carbohydrate, and it is going to reduce your insulin resistance. Insulin spikes it is going to reduce, and insulin resistance is going to reduce. Then after this, then you are going to drink 1 glass of buttermilk. Why buttermilk? Buttermilk is going to keep your gut healthy, and with lot of probiotics, it lot of like digestive properties. It is going to digest the food also. Then from afternoon lunch to till around evening 5 to 6 or 7 o'clock, you are not going to eat or drink anything. If at all you are drinking, drink this hot water, or if you cannot tolerate with your hunger, you can go with like a vegetable salad, like a soup, or vegetable salad or vegetable sabji you can eat. Then evening around 7 o'clock or 8 o'clock, you are going to eat like high fat food. High fat food means like either soaked almonds, around 10 to 20 soaked almonds, 10 to 20 all like walnuts, and then followed by coconuts, half coconut, and then you are going to eat some amount of vegetable sabji. Vegetable sabji, why? Because vegetable sabji is going to you are going to eat like something hot, like these almonds and all, you are not going like make it hot, and this will be very hot. And along with that, if at all you need any little carbohydrate like rice or like roti, preferably roti, like any ragi roti or jawar roti or any type of bajra roti or anything, you can go with that. Why? Because roti, while having roti, you are going to have lot of sabjis, because sabjis are very less in calorie and high in fiber and high in vitamins and minerals. So this is one, followed by buttermilk if it is needed. This is like evening around 7 to 8 we are going to end for the day with the eating things. Around this 8 hour eating window and the 16 hours fasting window. Morning whatever drinks we are doing, like vegetable like ashka juice or amla juice, the calories will be very less, and it will not be considered like a any type of intermittent fasting. It is not counted. Then coming to like eating fruits, like fruits should be avoided because fruits having fructose, and most of the patients who are having obesity they will be having a lot of fatty liver, and fatty liver fructose should be avoided, and no sweets and all. If at all you have any sweet craving, you go with any jaggery type of sweets following the lunch or dinner. Better it is going to be followed in the lunch, because sweet cravings will be there for all the obese patients. Like sweet cravings, we can eat the sweet, but the spike should not be there. That is why it should be after the food. Like before food, you should never eat the sweets. This is one thing. And very important tip what I want to give you, dear friends, is about the method of eating. Whenever we are eating anything, before that, for non-vegetarians, like how they can eat the non-vegetarian is, there is something called as Randall cycle, and all animal fat, and whenever there is animal fat and protein along with carbohydrate, there will be increase in the insulin secretion, so insulin resistance will be there. So we are going to avoid animal fat along with the carbohydrate. Suppose afternoon time, since we are eating lot of carbohydrate, this fat and protein in the evening time, and we can include this fat and non-vegetarian food in the evening time, not like in the name of biryani or in the name of a curry with a rice or ragi ball or anything like that. It is just a pure non-vegetarian food, like around chicken pieces, like grilled chicken or grilled fish or grilled prawns, or even the like mutton or whatever it is there, like we are going to eat in number of pieces without counting the calories. Like you can eat a number of pieces, but it should be like, it should not be mixed with any type of carbohydrate, any type of rice, roti, as I told, any type of carbohydrate should not be mixed along with this. In this scenario, what will happen? It is not going to increase the insulin secretion, and it is not going to increase any insulin resistance, and definitely it will lose your weight, because it is like you have to, once we reduce your insulin level, your body will be in the fat burning mode rather than the fat deposit mode. So after this, like one important method for eating is, like whenever we are eating anything, we have to chew well and eat it. Two significant benefits of this chew well. There is one more video I am going to make, but here I am going to tell you two significant benefits. Whenever we are chewing, we are going to chew around 30 to 40 times. Whenever you are chewing, the chewing should be in such a way that it is going to be like our saliva is going to mix with these food particles, and it is going to be finest particles. So finest particles are going to like it is going to absorb well, digested well, assimilated well, and all the minerals, everything will be absorbed and the digested well. And if we this is also going, suppose in 20 minutes we are going to eat around char rotis, 4 rotis, then if you eat well and chew well, and in 20 minutes we can eat only 2 rotis, and along with that within the 20 minutes the satiety hormone will be released, and we will feel like satisfied, I don't need food anymore, like that. And even the calories will be less, and also this proper assimilation of food will be there, where the digestion will happen and the weight loss will be, this calorie will not be counted to the body in that manner. So dear friends, this method what I told you, in this method we are going to use hot water every time whenever we are eating or even drinking soup, like it should be, and we are going to drink water in such a way that half an hour, either half an hour before food or half an hour after food, not like immediately like khana ho gaya gat pani piyo, not like that. So like followed by buttermilk, we can drink buttermilk immediately after food, and wait till half an hour to 45 minutes, then drink hot water sip by sip, like a drink, like eating something. It should be like eating something. And whenever we are eating, it should be like chew well nicely, and then you are going to you're going to drink that solid. So it is going to if you follow these methods, you are going to lose around minimum of 4 to 5 kgs in a week, in the first week, definitely, because first week to second week there will be lot of water weight loss is going to happen. Then there will be fat loss, like like water weight loss will be there, and then there will be weight loss plateau will be there. Weight loss is not happening anymore, like that. But still, why? Because fatty liver is there, but still we need to continue this method, so that we are going to lose the weight after maybe 1 month or 2 months, until this fatty liver is going to be like fat in the liver is going to be lost. So this is the method, dear friends. This method we can use this method, since it is a hormonal model. We can use this method for heart disease reversals also, and fatty liver, also high blood pressure, PCOD, stroke, erectile dysfunction, and then obesity, diabetes reversal, because all these issues are caused by high insulin resistance in the body, high insulin secretion and high insulin resistance. Whenever we are using this method, we are going to secrete less amount of insulin, and there will be less amount of insulin resistance and high amount of insulin sensitivity, and our body, whenever there is a lower amount of insulin in the body, our body will be in the fat deposition like fat burning mode. Whenever we are having high insulin in the body, so our body in the fat deposition mode. You can like there will be lot of patients with obesity. They will be having this black color neck here, and they will be having some skin tags, some black color in the near the forehead or ear. So that means they will be having lot of insulin resistance. When we adopt this diet protocol, what I told you, this is going to help you to lose significant amount of weight by reducing your insulin, by reducing your like insulin resistance, and not only weight, it is going to help you reverse all the disease, metabolic disorders, what I explained to you, dear friends. So like you can forward this video to all your friends who are having obesity, like diabetes, heart disease, hypertension. Everybody can do it. Under a medical supervision is better, but as long as they can use, it is going to help them to that much extent. So please share this video, and please subscribe to my channel. I am Dr. Rakesh from Dr. Hill Pain Cure Hospital, Bangalore. Thank you, Sneh.